Welcome to our YouTube channel. Today we will be looking at the fissures and foramina found on the human skull, and we'll also be looking at what passes through each of them. Firstly, taking a look at the cribriform foramina in the cribriform plate. The anterior ethmoidal nerves and the olfactory nerve or cranial nerve 1 will pass through this foramina. This cranial fossa is found in the anterior cranial fossa, and the cranial bone involved is the ethmoid bone. The optic canal. The optic artery and the optic nerve or cranial nerve 2 will pass through the optic canal. This is found in the middle cranial fossa, and the cranial bone involved is the sphenoid bone. Now taking a look at the superior orbital fissure. The structures that pass through the superior orbital fissure include that of the superior ophthalmic vein, cranial nerve 3, 4, and 6, the frontal lacrimal nasociliary branches of the cranial nerve 5, 1, so the trigeminal nerve, which is cranial nerve 5 and the first branch, in other words the ophthalmic branch. Please note this is found in the middle cranial fossa, and the cranial bone involved is the sphenoid bone. Looking at the foramen rotundum, the maxillary branch of the trigeminal nerve passes through the foramen rotundum. Please note that the trigeminal nerve has 3 branches, namely the ophthalmic branch, the maxillary branch, and the mandibular branch. Take note that the foramen rotundum has the maxillary branch of the trigeminal nerve, which is the second branch of this nerve. Please also note that it is found in the middle cranial fossa, and the bone involved is the sphenoid bone. Next we will be looking at the foramen lacerum. Please take note that nothing passes through this foramen, but the greater petrosal nerve does pass over it. This is found in the middle cranial fossa, and the cranial bone involved is the sphenoid bone. Taking a look at the foramen ovale, the accessory meningeal artery, the lesser petrosal nerve, and the mandibular branch of the cranial nerve 5 or trigeminal nerve passes through this foramen ovale. Please take note this is found in the middle cranial fossa, and the cranial bone involved is the sphenoid bone. The foramen spinosum, the meningeal branch of cranial nerve 5 division 3, the middle meningeal artery, and the middle meningeal vein all pass through the foramen spinosum. This is found in the middle cranial fossa, and the cranial bone involved is the sphenoid bone. Looking at the internal acoustic meatus, the vestibular ganglion, the vestibulocochlear nerve, labyrinthine artery, and the facial nerve all pass through the internal acoustic meatus. Please take note this is found in the middle cranial fossa, and the cranial bone involved is the petrous part of the temporal bone. Taking a look at the jugular foramen, the jugular bulb, the accessory nerve or cranial nerve 11, the glossopharyngeal nerve, cranial nerve 9, the vagus nerve, cranial nerve 10, the inferior petrosal sinus, and the sigmoid sinus all pass through the jugular foramen. This is found in the posterior cranial fossa. The cranial nerve involved is the anterior aspect of the petrous portion of the temporal, and also the posterior aspect of the occipital bone. Looking at the hypoglossal canal, the only thing that passes through the hypoglossal canal is the hypoglossal nerve or cranial nerve 12. Please take note this is found in the posterior cranial fossa, and the cranial bone involved is the occipital bone. Lastly, we will be taking a look at the foramen magnum, the dural veins, cranial nerve 11, the vertebral arteries, the anterior and posterior spinal arteries, and the medulla and meninges all pass through the foramen magnum. Please take note this is found in the posterior cranial fossa, and the cranial bone involved is the occipital bone.